if you're a neuro patient and you've got a neuro diagnosis and your therapist is running out every 5 minutes, leaving you to kind of fend for yourself, I'm gonna be honest, you need to seek someplace else.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
So today we're going to be talking about supporting the nervous system after concussion or TBI. How are you doing today, Dr. Lewis?
I'm doing great. How are you doing today? Today was a good day in the clinic. I can say a little tired, and now that it's the end of the day, but I felt good about what transpired clinically with the patients. How are you doing?
That's always good. I feel like I'm moving in the right direction. I feel like I'm much more attentive to my nervous system,
right?
Because I teach that quite a bit now with
Absolutely.
Other people. So I'm practicing what I'm preaching.
There you go. That's what it's all about. That's what it's all about. I tell my patients all the time. I say they motivate me to be less of a hypocrite. Because I can't tell them to do something and I'm not practicing what I preach. So
that is true. And we're, a lot of us healthcare providers, we are not good to ourselves.
We aren't.
We are not good to ourselves, and we need to do better because we're taking care of everybody else.
Yep. We need to be the example that we speak of, preach about, and teach of.
Yes.
And I think that's what keeps me on the road of trying to chase health and wellness. And that's what I love about this podcast, in teaching people how to do the things that they need to do from a nervous system standpoint to be the best that they can be. I practice what I preach.
Absolutely. And it's important, especially with our topic tonight about concussion and TBI.
Absolutely.
You're teaching these clients how to cope, how to manage.
Absolutely.
Outside of the clinic.
There you go.
It's super important.
Very important. And this is a continuation from what we spoke about in our last podcast regarding traumatic brain injury. And for those that don't know, this January is actually TBI Awareness Month. And so that's part of why we've been focusing on this topic this month, in January 2026, beginning the year, educating people on TBI, traumatic brain injury.
Yes. So tonight we're going to kind of talk about how care often ends before the nervous system has recovered.
Mm-hmm.
So a lot of our, clients are discharged based on function, but not regulation.
Oh, yeah.
And what do people know what regulation really is? That's the question.
That is the question. And I think that's a good segue for us to educate them on it.
Yes. Understanding what you need to do to cope, understanding, or even just acknowledging that you have anxiety,
right,
or that you're not calm,
right.
That's one of the things that's kind of brushed or pushed under the rug.
Mm-hmm.
Societal norms that we just have to perform and just be who we were,
right,
before the accident or before the injury.
Yeah,
but we need to really have that awareness of how are we feeling.
Yeah, exactly.
And figure out what do I need to do to de-stress? What do I need to focus on right now so that I'm focusing on me and what I need to do to function?
Exactly. And I think that's a huge point that you bring about, because first of all, the first step to improving is recognition of something occurring.
Yes.
So, from a clinical standpoint, the patient or the client or the person that has experienced something like a traumatic brain injury, whether it's mild or severe, um, they need to recognize that the nervous system is not um,
Fixed.
fixed or facilitating normal, what we classify as normal. And so
Mhm.
once they know that, like you say, with especially when it comes to things like anxiety, then accepting the fact that you are experiencing these things and
Mhm.
then seeking the help that you need to help regulate your system and regulate yourself.
Absolutely. And I think as a healthcare system, we do a very poor job of that.
Yeah.
And
I
that's kind of what I'm doing, which is kind of unique
right.
with giving, individuals a brain health assessment where they can see their stress on paper or they can see where their nervous system is landing. Are they in that
Right.
fight or flight mode, or are they in that backup mode, or are they in that rest and digest? They're not seeing that. They're just going
Right.
home, they're being discharged, and they're have to fend for themselves. They have a
Have to
follow-up
think of-
appointment, but
Yeah. And this is where I think we as neurophysical therapists can really come in. And I tell my patients all the time, because a lot of times they feel guilty about
Mhm.
coming in and verbalizing some of the things that they're dealing with systemically.
Mhm.
That is not a physical presentation. Well, I shouldn't say it's not a physical presentation. It's an indirect physical presentation.
Yeah.
And what do I mean by that? It's not um, something that you can see physically,
Mhm.
put your hands on, lay your eyes on, that kind of thing. But it's a experience that they're having. Like anxiety for some people doesn't always present from a physical standpoint, but they are experiencing it.
Mhm.
And so I tell them, I said, don't feel guilty for coming to us or coming to me and having a moment where you need to discuss these things with me, because we had to study psychology. I tell people all the time, Psych 101 was one of my best courses when I when I was in college. So that's part of what we do.
Mhm.
We help them to regulate their system, um, so that they can be the best, from a functional standpoint, but also from a mental and cognitive standpoint.
Absolutely. And I think it's so important to create a safe space for the client so that they are willing to open up. Because
Right.
will open up to you. They won't
Oh,
even open
yeah.
up to their own family member, but they'll come to the clinic and they'll tell you about their whole life and what's
Oh,
going
yeah.
on. And I I let them just do it because I'm like, you know what, you need to get this out and
Absolutely.
figure out, see you as a holistic person or
Right.
holistic being.
Hmm.
We need to know what's going on so we can pinpoint how we can help you.
Exactly. Because wellness is all encompassing.
Mhm.
It's physical, it's mental, it's spiritual. Um, yes, and having the ability to come into that safe space, delve into these things that are mental, but they're physically affecting you is so important. And that's part of why sometimes with some of my patients, when I see or I hear about these types of things, I will, the way our clinic is set up, we have some rooms that we can close the door and
Mhm.
it's just you and the patient.
Yes.
And I often also find it best when we have the caregiver kind of just stay outside those doors and it can just be me and that patient. And it kind of helps them to break through sometimes, even from a physical standpoint.
Mhm.
The sensory system responds to that. And so there's more regulation of the system. From a sensory standpoint, there's emotional regulation, and
Yes.
then patients can physically, therefore, now see some of the changes that they need to see from a
Mm.
neural standpoint and a nervous system standpoint as well.
Yeah, that's what needs to be had. And I don't think that is happening a lot in the PT world.
No.
Just being honest, I mean,
Yeah, if we were to be honest, and I think this is why it's surprising sometimes for people to come to a clinic such as yours or mine, where there's that one-on-one therapy, and that patient is being focused on and has the therapist's full attention and treatment skill set for that time frame. For us, it's an hour, and they don't have that therapist with this diverted attention that happens in some of the other clinics. Let's be honest. I mean, there are some clinics where a therapist is seeing 2 to 3 other patients at the same time. And from a neuro standpoint, that's being it's really a disservice to that patient, because they need the skill set that you went to school to gain and learn, and they need that skill set of all the certifications that you have and all that education that you have, all that training that you've acquired, so that they can be the best that you can be. If you're a neuro patient, and you've got a neuro diagnosis, and your therapist is running out every 5 minutes, leaving you to kind of fend for yourself, I'm gonna be honest, you need to seek someplace else. And I don't feel badly about saying it.
I agree.
I got 20 plus years of experience. If you want to come and debate me on it, come on. We welcome you on the podcast.
Right.
Look me up. Give me a call, email me, whatever the case may be.
And we get why things are set up the way they are. I get it. We have to make a profit. I get it. But you have to also think about the client.
Right.
Overall, and what the outcome could be.
Correct.
Could be much better if you really gave them that one-on-one attention.
Yeah. And I get it too, because I want to keep my doors open. And, I want to be able to pay my staff. I want to be able to pay myself. And I want to be able to know that I'm making a decent living.
That's it.
But I also want to know that when I go to bed at night, I'm sleeping well, because I've done the best job I can possibly do for that patient.
Absolutely.
And when you're talking about the kind of patients that we're focused on this month, traumatic brain injured patients, you really cannot do anything less than 100%. Traumatic brain injured patients, they experience, first of all, physical trauma that has changed their nervous system, their brain. There's been injury to the center of our existence. The brain is what controls everything else. And so if you're not facilitating a certain level of treatment with that patient, then they're not going to get the best as far as functional improvement that they can possibly get.
I 100% agree with that, which is a good segue to the lived experience, where clients are like, okay, I'm back to work, I'm back to my normal life, but they're not better.
Right. Not better. Yeah, there's a mismatch.
A real problem.
Which leads to fatigue.
Yes.
Mental fatigue.
Brain
fog. Big time. And you can kind of elaborate quite a bit on this based on your experience. And by the way, those that don't know, you need to know about Dr. Banks's book, Rest is Power. You need a copy, and you need to read it and implement those strategies in there. Because guess what? If you aren't resting well,
Yes.
Your life changes, not
It
for the
really
better,
does.
for the worse.
I
Especially when you get into that transitional time, like myself. I'm recent menopausal phases, and I tell you, the value of sleep,
mhm.
I really, really see now. When you're young, you can, 2 hours, and you can kind of bounce back and do what you still need to do. When you get to 45, 50, and you're not getting that.
Be tired by 6 o'clock. Ready
Man,
to
look at you. You dozing more than some of your patients.
for real.
So
Yeah.
elaborate a little bit on some of that for our viewers.
I mean, sleep is a big deal, especially with traumatic brain injury and concussion, because your brain needs to power down. And
Right,
that's the problem. Our brain doesn't power down well because we're not doing things during the day to help it power down.
right.
We're multitasking, we're doing, we're not taking a break, we're not taking time away from the computer or the phone. So
Yep.
your brain is constantly on,
On.
which
Yep.
means it's not going to power down at 9 o'clock when you're really tired. Your brain's
Right.
on at night.
Yeah.
So that brain fog is a big one.
Yes.
And that's because people are not sleeping. They're
Correct.
not getting deep REM sleep, which allows neurotoxins to be gotten rid of when you get that sleep. And
Right.
you wake up tired, you wake
Mhm.
up groggy, you wake up, maybe a little agitated because you just didn't rest well.
Didn't rest well.
So
Yeah,
that
and even though that we talk about, I said something about women, we
mm,
also need to remember this is not exclusive of men.
oh yeah, no, no, no. Not at all. This is for everybody.
Yeah.
It's a big problem, sleep.
Right.
Again, I go back to societal norms. We are just told that we need to push and
Yeah.
keep going and be your best at all times. And it's like we can be our best at all times, but we need to be okay with taking a rest day or taking time off,
Hmm.
really grounding and going outdoors and sometimes just doing nothing all day, not answering a phone, not looking at an email, nothing.
Yeah, exactly.
Brain needs that reset. And
Right.
it's the same for brain injury and TBI, concussion people as well.
Correct.
But are they being told this? No, because I had that concussion last year and not one doctor said to do any of this stuff. I was
Wow.
just blessed because I already know this stuff. I've been learning it. Nobody told me what to do. They just said it'll get better with time.
Right. That's
That,
unfortunate.
what is
Yeah.
that? It'll get better with time. I mean, there's people out here right now that are still walking around with concussions that never healed because nobody gave them the education on what to do or what they should feel or what things that they could be doing to get better.
Right.
It's
So
awful.
so education for this type of client or patient is so important in helping them to understand that you have to get your rest.
You have to rest.
Yeah.
There's no negotiation with that. If
None.
you're a big TV person, you got to let it go for a little while. If you like to scroll on your phone, you got to let it go. It's not forever, but
Hmm.
your brain needs to just power down and rejuvenate.
Correct.
And
Yeah.
you will get better, but you need to know this stuff. Most people don't know this stuff.
Right. Right. And that's where we come in. That's our job. That's why we're having this conversation. That's why we created neuro wellness conversations, because we felt like there was a gap
Mhm.
in educating people. Yes, there's Google out there,
Oh,
and
yeah.
there's all kind of AI apps that
Oh,
can
yeah.
probably give you the information, but how many people understand it from a layman's perspective? And how many people hear this? Like you said, the doctors aren't telling it,
Hmm.
and many of them don't, because many of them, first of all, it's a our health system is one that kind of leans more to medicinal practices. And um, now, don't get me not wrong. There's, you got your DOs and your functional medicine doctors and those kind of people, but most of us don't see those types of professionals often.
Nope.
So we don't hear this information. We don't hear that, somebody asks, how are you sleeping?
No.
How well do you sleep?
Mm-hmm.
I have to bring it into a example of a client. I have a client right now who had experienced a motor vehicle accident.
Mm-hmm.
And it was the second motor vehicle accident where she had an experience where she hit her head. Actually, she hit her chin. And shortly thereafter, she started having headaches.
Mm-hmm.
So when she comes to see me for her therapy recently, she was having a lot of other secondary issues, back and hips were hurting and necks hurting. She's had the images done. She's consulted with, primary care doctor, neurologist. Not one of them asked about sleep.
So
But
on their mind. Serious.
Yeah. So, and part of it for her that she never realized is one, the pillow that she was sleeping in was creating neck tension.
Yep.
Because her thing to me was, I wake up every morning with a headache. So immediately for me, my brain starts processing things and I'm like, okay, what kind of pillow are you sleeping on? How well do you rest? During the day, like you said, what she mentioned is she does not rest. She's go, 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 go all day. Now she's a stay-at-home wife, mom, but her kids are teen and in college now. Older, early 20s, late teens, so they're in college. But for her, there's so much that leads me to believe that her lack of sleep and lack of rest, proper sleep and proper rest, is facilitating so much of what's happening during the day and why she's having so much pain in so many other areas of her body, including her neck, which I think her headaches have a direct connection to the neck. I told her it appears as though she's having cervicogenic headaches.
Yep.
But I know from personal experience that if you don't sleep and rest well, headaches like that can occur. Because after I had my daughter, I actually went through a period of time where I was experiencing really bad headaches. Towards the latter part of the morning, early afternoon. And it took really a period of time and me kind of figuring things out. And then I realized that one day I slept really well because she was a little older now. And, when they're younger, you kind of sleep. You don't sleep you don't get into that deep sleep because you're concerned about, not hearing them and that kind of thing. And one day I had a really good restful sleep. And I noticed that I didn't have a headache that day. And so, I didn't really put two and two together, but I was like, okay, I've got to think about this again later on. So went back to that period of time where I wasn't sleeping well and the headaches returned. So I was like, bingo.
Yep.
My headaches have a direct correlation to how much and how well I sleep.
Yeah.
So if I rest, no headaches. If I don't rest, really bad headaches. And I'm telling you, headaches that made me feel like somebody was inside my head trying to chisel their way out. That's how bad they were.
That's pretty bad.
Yeah. So, and then of course, like you said, that afternoon fatigue, and but
Hmm.
being a fairly new therapist at the time, I was also on that go 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 go
Oh
kind
yeah.
of thing in that mode. So there, for somebody that's had a traumatic brain injury, similarly, especially when you talk about a concussive episode,
Hmm.
um, similarly, the emphasis needs to be placed on that person having good rest,
Rest.
rest for recovery. And that's exactly what I told her. And so she's still coming to the clinic. We're still working on things. She's doing a lot better with some of the other areas that she was having significant pain and things of that nature with.
Mm.
But now we've worked on, okay, let's look at a new type of pillow. Let's look at
Hmm.
if you don't have to wake up in the morning, or wake up throughout the night to constantly adjust and readjust to
Hmm.
make your neck feel more comfortable, your head feel more comfortable, then that also helps. So that was part of it for her. So we're working on it, and part of my learning was because of previous experience for myself, but also because of other patients, and actually what I've learned through your book
Hmm.
and some of your talks. So your teachings are so important, and your personal experience of what you've been through.
Oh yeah, because I had those cervical headaches as well, and it didn't feel good. But I had to get off the computer. I had to go to sleep on a regular, on a consistent regular time, good
Right.
early enough so that I can get a good 7 hours at
Mm-hmm.
least.
Exactly.
And that did help. And I have now you can record your sleep score with or like an Aura ring or an Ultra Human ring,
Right.
and it'll tell you how well you rested and what your recovery score looks like. How are you going to function for the day?
Right. Exactly.
Being made aware of that is just a game changer.
Yeah.
Because then
Yeah.
you can pinpoint, okay, I didn't sleep well last night. What could that have been? Was it too hot in the room? Was I too overstimulated yesterday? What could I have done better during the midday? So you kind of start thinking about those things,
Mm-hmm.
improve your routine so that you really do power down at night.
Right.
But sleep is underestimated. I don't
Yeah.
think most people think about that. It's not
Right.
asked on the a regular exam most times.
Right. Exactly. And what we want people to recognize and remember as well is that, you know, concussions, TBIs, these are nervous system injuries.
Yes.
Traumatic brain injury. That means that your brain has had some sort of, I mean, it says it in the description of the diagnosis. Your brain has had some sort of disruption, some sort of injury. And so when you have a disruption to your brain, it disrupts so many other things. Yeah.
Yes.
Your ability to process.
Literally your control center.
Your control center. Absolutely.
If you don't have the brain, you're not functioning. That's what I
Right.
tell my clients. If the brain's not working well, you're not functioning well. There's something that's going to be off. Even your stomach is connected to your brain.
Absolutely.
you know, your diet, your nutrition, that's all connected to your brain.
All
So
connected. I tell my patients all the time, head bone connected to the neck bone,
go. I like that.
so they can understand the interconnectedness
Yes.
of everything that, makes us us. You know?
Yes.
So when you have someone that has experienced something similar to you or has had a traumatic brain injury, if we have a neuro PT listening
Mm.
who's new in the profession, what would be some of the things you would do when that person comes to you initially?
So You definitely want to have a calm environment. You can't be in a busy clinic where other people are talking, it's too loud. You want a secluded space where it's quiet, they feel comfortable, and you can do a thorough evaluation. And you want to talk about their background,
Mm-hmm.
who they were before the injury.
Right.
You know, who do they live with? What's their
Right.
house setup? You know, how active were they?
Right.
Asking them how they're sleeping, like that's a big one. How
Yeah.
are you resting? Do you,
Yes.
do you drink coffee? Like those are things that you want to know.
Exactly.
And of course, you're going to do your neuro exam to figure out, you know, if they have any impairments with range of motion or coordination. Look at the eyes as well.
Correct.
Notice that a lot of therapists skip the eyes. How are they?
Yes.
You know, we want to make sure that they're moving correctly, that
Right.
their head turns are all writing correctly.
Correct.
Of course, you want to look at strength, range of motion, how they're standing, how they're walking, all those
Mm-hmm.
normal things that we look at.
Right.
But you also want to look at how they multitask. How do they think and walk at the same time? Can they do that?
Exactly. The
How
cognitive side.
the cognitive side is a big one.
Yeah.
And I do that quite a bit. And they're like, why are you asking me this? And it's not to,
Right.
I'm not trying to see if you're not smart or anything. I want to know how your brain is functioning right now.
Right. Exactly.
So that would be like the main things. And once you
Yes.
gather that information, then you can figure out, okay, what do I need to prioritize first? And sleep is probably sleep and cognition are probably the biggest ones
Yeah.
before the
Absolutely.
functional stuff.
Yeah. Yeah.
Figuring out what support they have at home as well. Is there
There
anybody
we
that can help them
go. Right.
through this?
The support system.
Yes,
Absolutely. That's huge.
it's huge.
Yeah.
The other thing I would say as outpatient therapists, resources. What other things can we tell our patients to do outside the clinic
Exactly.
that may be of help to them?
Right.
You know what I mean? And that might be referring them to another doctor. That's
Yeah.
okay. You know,
Exactly.
that's
All
okay
right.
to do that. If you don't know all the answers, it's okay to refer out. You can still see them, but refer them to somebody else that can help them with another issue.
Exactly. Yep.
But I think I hit on the big ones:
Yeah.
the sleep, figuring out their stress levels, how do they function at home outside of the clinic?
Right.
Because some people
Exactly.
put on a performance in the clinic.
Yeah.
They're all great in the clinic, and then they're falling apart outdoors. I mean,
That's the
outside.
truth.
Really get to know your patient, really
Yeah.
build that rapport with them, so that they really open up to you and
Yeah.
want to work with you and see those results.
Yeah. Yeah. I can say that for sure. Getting to know them is important, and then knowing what they're doing with you versus what they're doing at home. Because, like you said, the presentation at home can be completely different
Mm-hmm.
from their presentation in the clinic. And that's where the caregiver also comes in.
Right, the education.
Education.
Yeah.
So, educating the caregiver as well as the patient individually, but also collectively, so that they can be on the same page. Because you want the caregiver to be also an extension of you at home
Yes.
in some instances.
Mm-hmm.
And so, yeah, it's important that caregiver education. I think is so huge from the neuro PT standpoint,
Yes.
and a lot of times I think we take it for granted because it's we try to focus so much on the patient, but you
Mm-hmm.
have to think about, okay, how can we, and this is one of the discussions I have with my patients all the time. How
Mm-hmm.
can I get you to the point where we are taking some of that burden of care off of the caregiver?
Correct.
Um,
Yes.
so what can we do? So you've got to have, and in order to do that, you've got to have specific information from both parties.
Yep.
You know,
It
because
kind of
that load, that burden on the caregiver can be
a lot.
a lot, a
They're
lot,
burning out the caregiver.
burning out the caregiver. And just like you need the patient to sleep, you need the caregiver to be able to sleep.
Exactly.
So you're educating both equally, especially the patient on recognizing things that's causing their nervous system to not function properly, not work fully, is so huge. And when you I educate every session.
You
There's
have to.
something that I'm educating them on every session, and as a therapist, as a neurophysical therapist, and as a physical therapist in general, if you're
Mhm.
not educating your patient on every session,
What's the point?
you're missing the mark.
This is
Yeah, you're missing the mark. So that alone can help facilitate that patient regulating their system better at home.
Mhm.
They need to recognize, because at some point in time, I tell my patients it's like running a relay.
Mhm.
You're going to take the baton
That's
and
it.
run that leg after I run my leg. And so I've got to educate you on how it's going to be best to for you to run your race.
Mhm.
And so that's, yeah, huge moment there for as far as educating our caregiver and our patient.
The patient. Super important.
Yeah,
And that helps with healing, you know.
yeah, absolutely.
Nervous system needs consistency,
Mm-hmm.
not intensity.
Right.
You want to go back to who you were before the injury. So now
Right.
we have to have that awareness of, okay, this is what triggers me. This is what's causing me to have headaches.
Right.
This particular thing is stressing me out right now. Okay, now we know that. Now we got to do something about it
Right.
and be consistent with it.
Yeah. Yeah. I love that part where you spoke about if you're a therapist and you're not looking at the eyes of a patient
Mm-hmm.
that has had some kind of nervous neural insult. Um,
Yes.
because I do think that there's a tendency a lot of times to do an evaluation and miss that part.
Mm-hmm.
Yeah.
Yeah,
And
the
then
eyes are part of that brainstem.
absolutely.
That's the real main control center in his brainstem.
There you go.
Them messed up. It's a wrap.
Yeah, there you go.
Those eyes will tell us a story.
They
If
will tell a lot.
you're not tracking one way or the other,
Yep.
or your eyes aren't following when you turn your head, that's
Yes.
a red flag for us as
Right.
therapists. I'm like, okay,
Yeah.
there's something going on here.
Yes. Yeah. Yeah. There's a whole book that can be
Oh yeah.
read
Oh yeah.
with the eyes. Title, chapter,
Yes.
everything.
That is real. That is real. And that's
Yeah.
why it's so important for us to be thorough
Yeah.
in
Absolutely.
time with your client, you know, and make them feel comfortable so that
Yeah.
they'll listen, they'll follow through, and they'll get results, honestly.
Yes. Absolutely. Yeah. And that's why they're coming.
That's why they're coming.
That's why they're coming. Because, your 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 work will speak for itself.
Mhm.
Because like you said, sometimes you have to refer out. And so when you refer out, then you're not worried about whether or not that patient's gonna eventually come back. Because if you are so um respectful of getting that person better that you
Mhm.
send them somewhere else, that person is gonna appreciate you more than anything else.
Absolutely.
As an example, shortly after I opened my clinic, I had a patient that came to me, and I just felt like this patient needed more
Mhm.
pelvic floor therapy.
Mhm.
And I actually called up a clinic that was known for specialized pelvic floor therapy um, here in Peachtree City, Georgia. And I told the patient, I said, really, I honestly feel like even though there's some neural things going on, I think your primary issue is more from the pelvic floor. And I said,
Mhm.
that's really not my area of expertise. And I referred her out.
Yeah. Nothing
I
wrong with
tell
that.
you, probably, I don't even know if it was 2 weeks later, she emailed me and
Mhm.
thanked me.
Wow.
And yeah,
That's
and
awesome.
yeah, that made me feel so good and then she was like, because of because I know you cared so much
Mm-hmm.
that you did that. She was like, you will forever be in my heart and in my prayers, and I will refer
That.
people to you
Love
as much as, and almost had me in tears,
I bet.
when I read that, because she was like, I've never had anybody in the health profession do something so selfless. That she said it made me cry after my first couple of sessions, and I started to get some relief
Mm-hmm.
from her symptoms, and I was like, man, this is what it's all about.
That's what it's all about. It's good to refer. It's okay. We don't know everything.
Right.
Tell a patient in a minute, I don't know this. Let me look it up, or I'll pull out a book right in front of them and say, okay, this is what this is saying. Then we apply it to what we were talking about. Can't be
Yep.
afraid to do that.
Yep.
You know,
Yeah.
there's always something new coming out that we can't keep up with. So we gotta
Can't. We
read
can't.
it and apply it and keep
Yeah. Like you said, things are changing, especially in the world of neuro.
Oh my gosh, yes. Yes.
Changing rapidly. There's so much stuff out on the market. I mean, the emails and contacts I tell you that come through, and my email, and sometimes through text messages. I'm like, it's overwhelming. Sometimes there's so much that comes out. Because I try to stay on top of things, because it's all about trying to have the greatest knowledge to help my patients. But man, I tell you, it's tough sometimes.
Tough.
And let alone if you look at something online and social media, because your algorithm is going to be swarmed
For real.
with things.
Overwhelming. Like, ooh.
Yeah. But, it's about meeting the need for the patient.
Yes.
And that's what it comes down to, because a lot of them leave therapy without, that long-term nervous system plan. They need to have that guidance on that home exercise program, and then how to progress it. They need guidance on how to really just shape their day to day. And for, like you spoke about so eloquently about, having the best quality sleep that they can have, having that cognitive plan, like you talked about.
Yes.
So
important.
Yeah.
On those things.
Yeah.
Non-negotiable.
Non-negotiable. Non-negotiable. Filling the gap. You got to fill the gap.
Yeah.
They don't need endless treatment, because at some point in time they're going to get that baton, like we talked about. They need to run that race. When they get that baton, therapy on our side is going to end, but therapy on their side is going to continue.
Right.
And they have to continue it daily. Honestly,
consistency.
Daily. Consistency.
It doesn't have to be perfect, but consistency is key.
Consistency is key. I agree.
All the time. You don't gotta be perfect, but you gotta do it consistently.
There you go.
Change, rewire.
Yep.
This all day.
There you go. There you go.
Wow. This has been a great conversation.
It has. And I hope those that have listened have learned something. I hope those that have listened have an understanding of the importance of having your nervous system regulated, and knowing how to handle things a little bit better, and knowing that, healing happens with rest. Cognition improves.
Yes.
With rest. Recovery improves. Yep. With rest. And education of all of those things is so important.
Absolutely. And remember, your symptoms are not the problem.
They're the problem. They're the message. You hit the nail on the head, Doc.
Till next time.
Until next time.
Let's have a conversation about cognitive decline. Let's have a conversation about